Welcome to the Unhealthy Policy Podcast, where we break down how policy decisions in Washington actually play out in our hospitals, clinics, and communities.
Hi, everybody. My name is David Roach. I'm an infectious disease doctor, and I'm here with my colleague.
David, I thought we were friends.
Colleagues plus.
Colleagues plus. I'm Jake, not surprisingly, also an infectious disease doctor. And David, what are we going to be talking about today?
So today we're going to do an explainer, a little bit of the history, background, and kind of day-to-day function of Medicaid and how it impacts Americans. And then also talk about some of the policy.
Yeah, we're talking about damn cunts to Medicare and Medicaid.
Well, just Medicaid, Jake. We're just talking about Medicaid.
I haven't opened the news
Jake's
in
had
2
too much
hours. How do
coffee
you
today.
know? I have.
Jake's been drinking the coffee and getting angry about what's coming down the pike about cuts to Medicaid. So we're going to be talking about some of the major cuts that are proposed, up to $650 billion to be slashed from Medicaid budgets, which is going to have huge, devastating impacts.
Just all
So
the
that's
fraud.
what's on the agenda.
Just fraud, nothing else.
Yeah, I mean, I do think that people's healthcare is considered to be fraud in a lot of people's eyes. Like the basic provision of healthcare is considered fraudulent. And that angers me.
I got an icebreaker for you, David. Maybe you don't want to say this out loud, but if you were going to commit fraud, like what type of fraud would you do?
That's a great question, Jake. I have always wanted to be a rock star, a very unsuccessful musician, but kind of had a deep dedication to being famous that has failed utterly. But if I were going to commit a little fraud, I would 1000% pretend to be somebody rich and famous, for the adulation of the crowd, the free drinks, the backstage access, all that stuff, that the trappings of wealth and fame. I want that. And that's why I'm doing a podcast about healthcare policy to get famous.
Have you seen those guys that like dress up as like the maintenance people before the Super Bowl? They're like in the bathroom for 23 hours and then pop out and see their favorite team lose. Yeah, I think that's a good one.
Yeah, free tickets. So we're both on the free ticket train. That's about as good as we'd come up with. That's kind of lame.
Yeah, but what the heck is Medicaid? What the heck is Medicare? What the heck are we doing here today, David?
Well, we're not talking about Medicare. And I think oftentimes people confuse the two. But Medicare is predominantly for people over the age of 65. And so we'll just kind of leave that out for now. But we absolutely will be talking about Medicare in the future.
David doesn't like
Medicaid,
old people.
Well, I'm getting old, so it kind of scares me even more. Medicaid does not provide care directly, unlike the VA, which has like healthcare facilities. Medicaid is a public insurance program where they pay for care for individuals who are part of the insurance plan. And people who are part of that plan are typically the most vulnerable Americans. Historically, it was children, pregnant women, and people with disabilities. And then it's been expanded to include a variety of low-income Americans, depending on the state you live in. But essentially, what it is insurance for the vulnerable, the poor and the vulnerable in our country.
It was created in 1965 as part of the Social Security Act. It's jointly funded by both the federal government and the state governments.
Yeah, exactly. So it depends on the state. Every state is different. But the goal is for the states to pay about half of the money that's required to pay for care for the people who are in their state. And then the federal government matches whatever they pay. So the federal government pays for half. And between those two, we are able to take care of the vulnerable people in our population. And that is, it's been a major benefit for Americans over the years, since 1965 when it started.
I think what's interesting about both the federal government and the state governments funding this is that in exchange for federal funding, the states must follow specific rules that the federal government sets up. And we're going to launch into some of those rules that are potentially changing. And it's quite amazing how many people get their health insurance through a Medicaid program. The latest numbers I've seen is 72 million Americans were enrolled in Medicaid across the 50 states. That's about 1 in 5 people in this country. And another 7 million children were covered through the Children's Health Insurance Program, which is part of Medicaid.
And it's a huge way of how healthcare gets funded in our country and how people are able to afford basic services that they might not otherwise have.
And I think one thing that's confusing about this is every state has a different name for their Medicaid program. So many people that are listening today probably don't know, but they may be on Medicaid and not know it. So David, what's your favorite name for a Medicaid program?
I'm from Washington State, and we do a few things well. We grow potatoes, and people think Idaho grows the most potatoes. Actually, southeastern Washington grows more potatoes than Idaho. Somebody tell me I'm wrong. But what we also do really well is grow apples. And so we're called Apple Health, which is my home state Medicaid program.
Okay, Tim Cook.
Oh, no, no, this is not an endorsement of the Mac that I'm using. This is a comment on our locally grown, extra crisp, extra juicy, extra sweet Washington apple.
I like Husky Health, which is the Connecticut Medicaid name. And I think as you can see, each individual state, they get the money from the government, but then implement their own programs.
That's a really important point because after the ACA came out in 2010, the federal government offered an expansion of Medicaid to all low income adults, regardless of kind of their disability status. If they were just low income and couldn't afford insurance, they were eligible to get Medicaid insurance through their state. And the federal government said, we will pay for that expansion of Medicaid. Importantly, 10 states, I believe they're all Republican states, have declined to
There
expand
ain't red
Medicaid.
states, there ain't blue states. There's just the United States of America, David.
Yeah, I wish that we were all united in our desire to provide insurance for low income adults, but we're not.
I love to look at states that expanded Medicaid and what happened in those states. We have about a decade of data now. And what they found is that there's better health outcomes for individuals, better financial security for low income individuals. They're not going to be laden with all this medical debt. In addition, there was greater insurance coverage, improved access to doctors and medication, better self-reported health, and even economic benefits to the states and the communities that these hospitals are sitting in.
Yeah, it makes total sense. If you were somebody without insurance and you got sick for whatever reason and you had to go to the hospital, you got saddled with those hospital bills. And that was the number one cause of bankruptcy in America was due to healthcare
Right.
costs.
We shouldn't be
And the
choosing getting care versus being bankrupt. That doesn't make any sense.
yeah, not it. I mean, it shouldn't, but here we are. And since the ACA has rolled out, those numbers have changed dramatically. And as Jake mentioned, in states that have chosen to adopt it, they've seen those benefits. And in states that haven't, obviously, people are still going bankrupt for their healthcare needs.
I do want to talk about a quick example, and that's breast cancer. So women are screened in this country starting around age 40 or maybe 45. I don't know. I'm an ID doctor. But they do mammograms and they look for early stages or precancerous lesions of breast cancer. The expanded Medicaid system pays for these screening tests. So we're detecting and treating breast cancer earlier. So those women aren't getting breast cancer and then spending more money to try to get chemotherapy and get treated. So this preventative care that before the expansion was unavailable to many low-income individuals was suddenly now available.
One thing that's really interesting is that even within states, there's like a lot of regional variation if some parts of the state are on Medicaid. And in my home congressional district, the Washington 4th, 70% of the children who are in that district have their health insurance through Medicaid. Whereas in King County, where I went to med school and where I lived for 12 years, only 26% of children were on Medicaid. And so even within states, there's this massive difference in how much people are covered by Medicaid versus not. And so you can really think that if those Medicaid benefits are all of a sudden removed, then now there are going to be massive health disparities even within states, just because a lot of people can't afford insurance anymore.
So Medicaid is funding these hospitals, is funding the community health at large. And if that goes away, even people who remain with insurance aren't going to be able to find a hospital to take care of them if that hospital doesn't exist anymore.
Can you talk about that a little bit more? I mean, what is going on at these hospitals in rural areas and how much of their money do they get through Medicaid versus, people who are able to pay with private insurance?
Yeah, exactly. So some hospitals, up to 70% of all of their revenue is coming through Medicaid. So the 30% of the other patients are paying. Those hospitals are not going to be able to support themselves if suddenly a bunch of people become uninsured. And why is that? Because they're going to have to give out uncompensated care. You have a motor vehicle accident for someone who's uninsured. We have laws that in the emergency room, appropriately, they should get treatment. But who eats those costs? It's not the government anymore with insurance. It's going to be those individual hospitals. And it's just economics 101. you can't support all this uncompensated work and survive as a hospital.
And rural hospitals, even with Medicaid, are struggling to get by. We've seen a lot of closures of critical access hospitals, we call them, kind of small hospitals that serve remote populations. A lot of those are closing. If $650 billion of compensation disappears from the American healthcare system, those hospitals are going to go under. And it's just going to further exacerbate the problem. A lot of these areas having way, way, way worse disparities in healthcare because not only are they not insured, but now they don't even have access to healthcare because it doesn't exist in their region. And those hospitals are not just serving patients who are part of Medicaid and you think maybe shouldn't be getting healthcare in the first place if you're, whoever, nobody on this podcast. But they're also the places that are providing care to pregnant women. They're also the regional access for trauma.
Right. The
They're also
infrastructure, the healthcare infrastructure in these rural areas are built by Medicaid.
and not to mention they're an employer for some of these regions, sometimes the biggest employers in the region.
And then they
And
won't be able to
if we
work and they
just
won't work. They won't be able to get their Medicaid.
Yeah, you kick all the nurses off, they're gonna not meet their work requirements. They're not gonna be able to get Medicaid, and yeah, then what happens? I mean, it's we're kind of joking, but it is a real problem that as these healthcare facilities go under, major employers in some of these more rural areas, they have to lay everybody off. And obviously that has economic disruption beyond the healthcare impacts. I think that's probably enough just kind of background on Medicaid. Essentially, the top line thing is it's been an essential part of the American fabric for 60 years. It provides an enormous amount of funding for healthcare for low income individuals, pregnant women, children, and ultimately ends up providing healthcare coverage for a quarter of the American population, especially those in rural areas where this might be the only game in town. And if Medicaid is cut, then those areas will not be able to support healthcare infrastructure and provide care to entire regions. And I think it's just like clear that it's essential to how we function as a country.
So, David, let's dive in a little bit about the specific policy piece that has been proposed regarding Medicaid.
Republicans are working on their budget bill. And because they're in charge of both chambers of Congress and the presidency, they get to decide what goes in this bill. And they're trying to cut a lot of money. They're trying to cut a lot of services for the country as a way to pay for tax cuts. And so what does that actually look like for Medicaid in this case? Well, Medicaid is one of the major sources where they can suck money back out of the system because it is a lot of money. It is a lot of money. They're currently proposing to cut $650 billion from Medicaid.
And that's over 10 years, so roughly $65 billion a year.
Correct. So over a decade, $650 billion, so $65 billion a year. And obviously that money has a huge impact on all those things that we talked about
And
before.
spoiler, how are they doing that? They're finding ways to kick people off of Medicaid.
Yeah, how many people are they going to kick off, Jake?
Damn near everyone if they keep going the way they're going. But no, seriously, somewhere around 10 to 14 million people, depending on what analysis you look at. So I want to talk about some of the specific changes besides that top line number that they're going to implement. The first one is work requirements. So as it stands now, the majority of states don't have any work requirements, meaning if you lose your job and you don't find a job for 6 months or whatever time period, you can get Medicaid and you can stay on Medicaid as long as you qualify by income and get your health care. What Congress is doing right now is requiring people to work to get insurance. So they have some carve outs, like if patients are disabled or what they call kind of health fragile. I don't really know what that means. They don't need the work requirement, but the vast majority of people currently on Medicaid are going to have to prove that they're working. And one worry that I have, I hate paperwork. I thought the Republicans were the ones that hate paperwork, hate inefficiencies. You're going to be telling me that 73 million people are going to have to fill out paperwork every year? 5-10% of them are going to check some box wrong and lose their insurance. And I think that's what Congress is counting on, right? Because the only way you save money is if fewer people are insured by you.
That point, Jake, it's really hard to kind of keep up with all of the paperwork that is required if you have to continually, on top of your job, say that you have a job and are able to prove that. And who knows what kind of onerous hoops they're going to make you jump through in order to demonstrate that. Because the real goal is to get people off of the insurance. That's the goal. And beyond that, I personally believe that people deserve to have healthcare insurance, regardless of whether or not they're working. I mean, that just doesn't seem like they need to go together. I think we should consider those things to be different from each other. People should be able to get health insurance even if they don't have a job. People should be able to get health care even if they don't have a job. I just want to say that because that's the right thing to do. And that's the right thing for us to do as a country. And for us to remove that kind of fundamental right from people to give tax breaks to the wealthy, to me, seems like a grave disservice to the population. And honestly, it's kind of fucked up. Like, I'm just going to say it. It's genuinely is.
David, when do people need Medicaid? It's when they lose their freaking job because of a recession, like we all saw during COVID, like we all saw during the Great Recession. Not to age ourselves. You lose your job because of factors outside your control. And they're like, oh, just kidding. You can't have health insurance. I mean, what kind of country is that?
Yeah. Yeah, not only do you lose the health insurance that your job was providing, but then now you don't have access to health insurance because you have to have a job in order to have health insurance. It's crazy. If you have a job, oftentimes your insurance is provided through that job.
Right. This is why
It's mind-boggling.
it sounds good as a talking point. We don't want lazy people on insurance. We want them to work. But all it's doing is kicking people off their insurance. That's the only way this saves money. And in fact, you have to think of the administrative cost of just processing all this paperwork and making the government bigger around this whole process. It's just so ridiculous.
And that money that is used to kind of pay for all that processing cost, that's not money that's providing healthcare. That's money that's providing paper care.
Yeah.
It's just like clearly administrative burden, clearly bureaucratic hurdles that are designed to prevent people from getting the care they need.
Another stat that's wild is currently 92% of people on Medicaid are working. So it's not like there's this huge epidemic. You're talking about the small percentage of people who really can't work, having trouble finding work, and punishing them further.
To that point, Jake, like 92% of the people are already working, but they're still going to save $650 billion by kicking these people off. So really that tells you that they're just going to make it impossible for people to get care with these regulatory burdens. And they're just going to make it so much harder for people to get it. And anybody who listens to this, who is on Medicaid, could be pissed.
We got to talk about what happened in Arkansas.
What happened in Arkansas, Jake?
I don't think you know
they
this.
won the national championship. I don't know.
What sport are we talking about?
Probably football, Razorbacks.
All right.
I think so.
Arkansas tried this. In 2018, 2019, they implemented work requirements. A quarter of people on their Medicaid lost health insurance. And when they did an analysis of why, they just missed the paperwork deadline. That was the major reason that all these people got kicked off. They then looked at, did more people join the workforce, right? If now there's a work requirement, no one joined the workforce. No additional people started working because of this. It's just a way to not give people healthcare in the country that are poor and save money so you can do whatever you want with it. In this case, tax breaks.
So if you are on Medicaid, if somebody you love is on Medicaid, be upset about this. People who are on Medicaid predominantly live in areas that are represented by Republicans who are helping to craft this bill. So, I mean, honestly, if you know somebody on Medicaid, if you live in an area that has hospitals that get funded through Medicaid provisions, you absolutely should be calling your state representatives to try and raise a fuss, because this is going to have real impacts on your family, yourself, and potentially the region you live in. It's a major loser for America.
I talked about the Razorbacks for one more second. The great state of Arkansas. They looked at health outcomes the 2 years after this work requirement was put in place. I bet you can guess what happened. Patients skipped their visits, stopped taking their medications, and were saddled with more medical debt. I don't know why that's the version of America we want to live in.
I mean, nothing against Arkansas, but this seemed like a really unhealthy policy. It's been interesting to see where some of the pushback has come from. I mean, obviously, the Democratic Party are getting upset about this, but this is even rankling some Republicans. So Senator Josh Hawley published a big op-ed where he was blasting this proposed cut to Medicaid because now the Republicans are styling themselves as the party of the people. But really what they're doing is cutting the services for their constituents who they say they have their best interests at heart. And clearly they don't. And I mean, at least Josh Hawley is calling them out for that hypocrisy. But it's been pretty remarkable to see that these areas are consistently voting against themselves. And a really good example of that is in my home state of Washington. So there, 9 of the 10 counties that are the highest per capita users of Medicaid voted Republican. These areas that vote red are not being supported by their representatives and their national leaders because they're the ones that are going to get hurt the most. And I just think we should all be aware of that and call it out because it's true. And it's sad.
David, it's time for your favorite segment, not the DDCUs, but the Billionaires Unit of Yachts.
Oh, hell yeah. Who are we talking about this time? Which yacht? I mean, I think that's the important thing. It's not just about the billionaire, it's also about their yacht.
That is true. So we're going to be talking about a starter super yacht, roughly $80
Like a starter
million
home?
dollars. It's like a starter
You mean like,
home, but for billionaires, right? When you don't want to go all the way in for your $500 million yacht. It turns out that these cuts, $65 billion a year, if that was distributed equally to all the billionaires in the United States, of which there's about 800, each billionaire could buy one starter super yacht. Or
that?
14 million people in the United States get their health insurance to support the healthcare infrastructure in rural communities. Children's maintain their healthcare. I don't know.
Yeah, it's close. I like that though. We need to think of all billionaires together, but thinking about them as a group, as an entity, kind of like the 14 million people who are going to lose their healthcare.
Million people, healthcare, 800 billionaires with a starter yacht. I don't know.
Yeah, it's a tough choice. Toss up.
Awesome.
I don't know. This one might be healthy policy, actually.
Can we do that section? We haven't done that section yet.
Let's do it. So, Jake, is this current policy on the table healthy or unhealthy? And you tell me what you thought was the most unhealthy part of it.
Oh gosh, I don't even know where to start. Honestly, this policy just makes me so angry for so many reasons. But the thing that really stuck with me is just that 14 million people are going to have less insurance or no insurance. At the end of the day, 5% of the United States, just like that, no insurance to save money. And I think that is, for all the reasons that we've talked about, an unhealthy and unfair policy.
For me, the biggest thing is how this is going to impact healthcare infrastructure in rural areas. This is going to have a massive, lasting impact on the ability of healthcare to be provided throughout huge swaths of the United States. And we're doing that at the expense of the people that live there, whether they have health insurance or not. And Jake, before we go, I do want to just get your thoughts on the snatched cat scale about where this stands. 5 being the perfect size of a cat. Higher numbers mean that cat's a little bit overfed. Lower numbers mean that cat's underfed. Where does this rank in the snatched cat scale?
Yeah, so I actually think if you look at Medicaid itself, I think it's too skinny as it is right now. I actually think we should expand Medicaid so more people in the country have health insurance, not tie this to work requirements. So I'd give it probably a 3.5
At baseline.
at baseline. So I think we need to actually improve Medicaid and Medicare, but the policies that have been proposed are going to take your already skinny cat and make it freaking emaciated. It's like a person with a BMI of 19 on freaking Ozempic and getting them down to a BMI of 15. That's just unhealthy policy, even if you love Ozempic. So I think adding the policy on the existing skinny Medicaid is going to make it even skinnier, probably down to a 2.
Tiny little cat. That is an unhealthy cat.
That's unhealthy. Give that cat a
All right.
cheeseburger.
Give that cat a cheeseburger. All right, everybody. My name is David Roach. I'm an infectious disease doctor, and thank you for listening to us today.
And I'm Jake, also an infectious disease doctor. And that's it for the Unhealthy Policy Podcast.